Today I am in our South Burlington office just finishing up my day with patients on Thursday, so I'm going to post it tomorrow. But today I wanted to talk about a really fundamental exercise that I teach pretty much every day to pretty much every patient, and it is called the posterior pelvic tilt. And the posterior pelvic tilt is aimed to engage a muscle called the transverse abdominis. So it's a very deep core muscle, and everybody doing crunches in core exercises much of the time is targeting that really nice, pretty six-pack muscle that kind of ripples down the front this way. And the fibers of the rectus abdominis run this way. Underneath the rectus abdominis, you have the transverse abdominis, which is deeper. And the fibers actually run from here all the way around to your lower back this way. And the fibers run like this. So when you actually engage it with that posterior pelvic tilt, what you're doing is you're compressing the spine and essentially loading the spring to make it much more stable. So I teach this exercise to my children who are gymnasts, who tend to kind of stick their butt out when they're landing. So it's extremely important to kind of tilt that, not posterior like this, but into a very neutral position, okay? I also taught it to a patient who was 80 years old, who had crippling low back pain. I teach it a lot to pregnant women who have a really kind of pendulous belly on the front, and we want to balance it on the back. And I teach it to pretty much everybody who has low back pain, even upper thoracic pain. It really helps to work with posturing. Okay, so it's a very, very simple in concept, but it's very challenging to actually engage correctly. As Allie, our athletic trainer who's actually helping me today, can attest to. So really very simple. You can do it standing, you can do it lying down, you can do it on a physio ball, but what you really want to think about doing is, I'll go sideways here, you want to think about pulling the top of your hips right here, the ASIS, kind of crunching them closer into these bottom ribs. Okay, so that's kind of the motion that you want to do, but you want to generate it from just above your pubic symphysis. So you really want to tuck that tail right underneath here. So you don't want to go excessive again, and what you want to do is just into a neutral position. If you do have any low back pain, it should actually take that away. And I'm just going to get in a hook line position, so could you mind getting that for me? Okay, so I'm going to go this way to demonstrate it on the floor. And sometimes if you put your hand underneath the small of your back here, you can give yourself some biofeedback. And what you're wanting to do is engage your lower abdominal muscles by rocking your pelvis backwards like this gently. What you want to avoid doing is bearing down and kind of pushing really hard. You also don't want to use your legs, and you don't want to arch your back up to try and do this and lift your bottom off too. Okay, so really, really gentle. You're just going to rock it back slightly. You only need about an inch or less of movement through here, but it should be nice and firm and tight right along here. And you can hold it just by your sides, be able to breathe and talk just like I am, and holding it there for a good 10 seconds, and then relaxing, and then 10 seconds, and then relaxing. You can also do this as you're standing against a wall if you need that feedback, and it's really great to do it actually on an exercise ball too. You'll get that unstable surface, which will kind of fire all those core muscles too. So I hope this was helpful. Please leave any questions in the bottom, and I will get back to you and see you next week. Thank you.